The wand can be used on either end, and it can be inserted vaginally or rectally. It depends on what angle you're trying to get at and what part of the body you're trying to reach, and also which end feels most comfortable to you. So my recommendation when you're first starting to use the wand is that you start with the thin, more long aspect of it. And for most people with pelvic pain, they'll be using it vaginally. Some will be using it rectally if you have tailbone pain or if you are male. So you're going to insert the long line either into the vaginal opening or the rectal opening and through the back. And from there, I recommend inserting it just about 1 inch. So it's going to come into the pelvic cavity about 1 inch here, and just get a sense for how that feels. From there, you can gently sweep it around in a circle. So if you have it inserted like this, just making a gentle circle to get a sense of if there's any tenderness at the more superficial aspects of the pelvic floor. If you find one, you can hold that gentle tomato touch pressure. So tomato touch, never pushing any more than you would use to check a tomato for ripeness. And some people benefit from gently moving their legs, so with the knee bent, rocking in and out. And then from there, once you have relieved that area, you can insert a little bit deeper. So from there, you can come up to about 2 inches. And again, just gently sweep down and around. Recognizing that if you're inserting it vaginally, the bladder sits right in the very front of the pelvic bowl. So if you come in really hard at the 12 o'clock position, so in the vaginal opening, if 12 o'clock is forward towards the pubic bone and 6 o'clock is back towards the tailbone, and you come up and put a lot of pressure forward at the 12 o'clock position, the urethral tissue is very sensitive, and that can leave a painful sensation in some people. In some people, it won't be painful at all. But the fascia around that area can be quite tight, and it can lead a spasm sensation that in some people can feel like a UTI, but if you have the urine tested, most of the time it is free of bacteria. So if you have an actual UTI, it's a good idea, obviously, to follow the course of medication, but it is possible to simulate a UTI-like experience by compressing too far forward in the 12 o'clock position with the wand. So just being mindful of that as you circle through. So for most people, they will have tender points in this location here to the right and left of the vaginal opening or the rectal opening. So here's the vaginal opening here, here's the rectal opening. So it's common to have tender points here. It's also common to have tender points in obturator internus, these muscles in the far wall. So to get those, you would insert the wand and rotate the wand out laterally, out to the side to reach that muscle. And again, never pushing harder than you would use to check a tomato for ripeness. Many people will also have a tender point right in the front wall. And for that, I recommend using the shorter pointed end, and you will come in with the wand like this and hook it to come forward just like this. So it's going to come forward right into that spot, but inside. So it will come in and hook in right here. So once you locate a tender point, being really gentle, you can move your leg, you can move your body to help reduce the tension. I do not recommend just sitting there and trying to hold your breath or deal with pain. So keep it at a 2 to a 4 out of 10 or less while using the wand. And be really sure to take it slow in the first couple of weeks of using the wand. So I don't recommend using it for more than 5 to 10 minutes in the first couple of courses. And with more questions, be sure to visit intimaterose.com.